My name is Bobby Daly. I'm a medical oncologist at Memorial Sloan Kettering Cancer Center in New York, New York. I think the most influential aspects of the implementation were the systematic monitoring of the patient's symptoms post-discharge so that we could intervene early to manage those symptoms. So the patient's symptom reports were tied to alerts to the medical team, and so our nurses were able to potentially catch symptoms early to help prevent readmissions. Patients really endorsed high satisfaction with the ability to report symptoms from home via the electronic patient-reported outcome. The Net Promoter Score, or how likely they are to recommend it to other patients like them, was greater than 80%. So there was a lot of engagement from patients around being able to report their symptoms from home and have responses from the medical team to help manage those symptoms. I think a key piece of implementation is education. Education both to the patients about how this can be helpful to them in our management of their symptoms, as well as education and support of the clinical staff so that they have the right workflows in place to respond to the symptom alerts to help manage those symptoms. I think what's most important to highlight about the results of this study is that we're specifically looking at the population of patients who are discharged home after an inpatient admission. We know admissions are periods of high distress both for patients and their caregivers, and that 1/3 of patients who are discharged to home are readmitted within 30 days. So the ability to impact that readmission rate through systematic symptom monitoring really helps us improve the care for our patients with cancer going home after hospitalization. I think the most important next step is figuring out the right intervention at the right time for the reported symptom. So for example, if a patient is reporting severe pain, do we have the right teams, clinical teams in place to help manage that patient's symptom in the home to prevent that readmission? So really matching the symptom report to the right intervention in an expeditious way to help better care for our patients in the home. I think as far as our future directions, we're looking at how do we bring other components of care to the home. So thinking about things like home labs, home vital sign monitoring, all with the goal of bringing care into the community where patients are and helping to prevent acute care utilization.